Thank you for inviting me to this important global event. This is a significant time in our history, and my book, Vaccination: Australia's Loss of Health Freedom, was published in March this year, at exactly the same time as the world went into lockdown and our freedoms were removed. Many of us have seen this situation coming for years. Human rights are being removed based on false scientific claims by a medical industry that is not accountable for the science that it is using in government policy. The peer-reviewed system of science is broken, and money and power are driving global health policy in a capitalist model of health. There is no oversight for the peer review system of medical literature, and pseudoscience is being used to remove health freedoms in 2020. Lockdowns, social distancing, coercive vaccination, medical testing and masks for healthy people are the opposite measures to how we have successfully controlled infectious diseases for decades. All of these measures will make the population less healthy, and they have no scientific basis in the current outbreak of disease. This is because the global pandemic has been declared based on a change to the definition of a pandemic, and the prediction of enormous numbers of deaths were made using flawed assumptions in a mathematical model. This is not a pandemic that has been declared by actually observing how the virus behaves in the population of all countries, or by observing enormous numbers of deaths and illness in the community. This global pandemic does not exist outside our TVs and mainstream media outlets. Bodily autonomy is the most fundamental human right that we have. Our quality of life depends upon this right. There is no freedom without the right to control what we put into our own bodies. Clean air and water are irrelevant if the government can decide what is injected in the name of health. My research investigated the historical control of infectious diseases and the rigour of the claims that governments are making about the vaccine safety and efficacy. I found that these claims have been made on undone science, not actual scientific evidence. The studies to collect the hard evidence to prove that vaccine reactions are rare have not been done. This area of science has been defunded. The evidence shows there is a direct dose-response correlation between the significant decline in children's health and the increased use of vaccines for 3 decades. The government calls vaccination a health policy, even though children's health has been declining, and the government does not promote this program on health outcomes. Chronic illnesses, autoimmune diseases, cancers, encephalopathy, and neurological damage have all increased in children since 1990 as the program expanded with financial incentives for both doctors and the public. When parents asked why the government has not studied the safety of the combined program of 16 plus vaccines in children, the medical industry claims that it would be unethical for a child not to get a vaccine. This is a false and dangerous claim. The truth is that it is unethical to mandate vaccines that have well-documented side effects without testing the long-term health effects of any vaccine or the combined program of vaccines. Vaccines have always been a choice in society because they were introduced after infectious diseases were controlled. And they have never been mandated in any health law because of this fact. So there is no legitimate health purpose for coercive vaccination under social services policies that deprive people of their rights in society if they do not vaccinate. Governments do not have powers to violate human rights if there is no legitimate public health purpose. Australia overstepped its powers in 2015 by approving coercive vaccination in social services policies that were not mandated in health laws when they were approved. Healthy people are not transmitters of disease, and it is asymptomatic cases of infection that result in herd immunity in the community. There is no justification for mandating any vaccine or medically testing healthy people. Coercive vaccination is a crime against the population because of our diverse genetics. It is an experiment on the population that is not being monitored. The claims of safety and efficacy are being made by ignoring the decline in health that is accompanying the program of vaccines. The public is being indoctrinated with the claim that vaccines are safe and effective in education programs, research institutions, and the media that only presents the exaggerated benefits of vaccines. We have had censorship of the vaccination debate for the last decade through groupthink, intimidation, and bullying tactics. In Australia, parents have given their children's bodies to the government to decide what to inject in the name of health. They did this because the media provided them with false and misleading information about vaccines. Journalists are complicit to the crime that is being committed against the public. If governments were required to use the precautionary principle in the design of health policies, this situation could not exist. This principle requires that the onus of proof of harmlessness of any vaccine is on the government and the pharmaceutical companies, not the general public. I would like to appeal to all doctors, nurses, and lawyers. Now is the time to stand up for integrity in medicine. There is nothing left to lose if we lose our right to bodily autonomy. The medical profession has not proven causality for this COVID-19 outbreak, and our freedom is gone if we comply with any of the measures that have been introduced against the science of infectious disease control. I call on everybody to stand up together to support the Nuremberg Code and the Doctors' Ethical Code of Conduct that prevents experimentation on the population. I am honoured to be part of this event today, and if we make the government accountable for the science that is being used in health policies, we can maintain our right to choice in all medications, including vaccines. This is essential if we are to prevent experimentation on the population and destruction of the genetic fabric of society.